Hi, my name's Sarah, and I'm doing my case study over Sandra for the presentation. The current situation is that Sandra has been struggling with substance abuse for 10 years. She has been to a 90-day treatment program before, but she has since relapsed since the birth of her child, Joshua. She recently became addicted to painkillers and other street drugs after the birth of her son. And there's a few other family problems, and Sandra is a single mother of 2 children. And her daughter's father is very involved, but her son's father is not. But her daughter's father often helps out with both children. The family composition is that Sandra lives with her 2 children, Joshua, who's 9 months old, and Kayla, who's 4 years old. Joshua's father is not in his life and has recently moved away after his birth. Kayla's father is very involved, sees her frequently, and John is Kayla's father, and he sometimes helps with both children, so he's a very good support system for the family. Sandra's mother is also very supportive, and her co-parenting relationship is currently tense because of her drug use. So this is the genogram. At the top, we have Sandra's mom, and then we have Sandra, who's 28 years old, and this is John. She separated from John, and they have 1 child, Kayla. And then this is Joshua's father. They don't have a good relationship, and Joshua's father's relationship with Joshua is not good as well. And there's Joshua. So for the biological aspects, Sandra is a single mother living with her 2 children, one of which has an absent father. There are many stressors in her life that have an impact on her mental health. And the main stress factor is her substance abuse and addiction. Sandra's employment status is unknown, but it is assumed that she has some form of income since she does have her own place with her children. And if she is employed, the addiction may be causing strain on her work performance. And the substance abuse is not only a stressor for her, but for the whole family as well. And it is unknown if she has any health problems, but research studies show that people who have addiction also have risk for many health problems, so it may be beneficial for her to get checked out by a doctor to see if she is at risk for any problems or if she does have any health problems. For psychological, Sandra reports that she is a very engaged mother, and she does a lot of activities with her children and spends a lot of time with them. She does seem to have a kind and loving personality, especially with her children. Her substance abuse has had an impact on her personality, and this can lead to stress and other mental health issues. Although she says she takes care of her children well, she has neglected them in the past, and she has been a report has been made against her one time, but there was no case opened up. And then loss of money from buying drugs can be another stressor in her life as well, especially if she doesn't have a high income. For sociocultural, Sandra is in the intimacy versus isolation stage, according to Erik Erikson, and the stage ranges from 18 to 40 years old and is focused on love. Sandra has been in a couple relationships before, but none of which have worked out, and this could lead to loneliness since she does not have a partner, and that could also have an impact on her mental health as well. And she's also a single mom, so that stress can build up for single moms as well, since she does not have a partner living with her. It is unknown if she is religious, but if she is, it might be beneficial to help her get in touch with a church or another place of worship. She does have a good support system and has 2 good people that are supporting her on her recovery journey, as well as her children. And it might be beneficial for her to expand her circle and possibly meet friends who might be going through the same situation as her, so she can have someone to bond with and talk to. Some of the protective factors is that Sandra has many strengths that will benefit her on her recovery journey. One strength is that she strives to do better for her children and is taking the steps to do better. Sandra has gone through a lot, and although she is experiencing addiction, she is resilient and is working to get better for herself and for her family. Some strengths of the family would be that they are supportive of her, and John and Sandra's mother are very supportive of Sandra and her recovery journey. And this is beneficial for Sandra because she can seek out the help she needs without the stress of worrying about how everyone's going to be taken care of. So for the action plan, first, kinship care would be an important thing to go to first. Making sure that she has someone to look over her children, and kinship care is when children go into the care of a family member when the parent cannot. This would be beneficial, so when she goes into treatment, she won't have to worry, and John can also help with both kids on the weekends like he did in the last time she went to treatment. Substance abuse treatment would be the next course of action. Another 90-day treatment would be beneficial for Sandra. She needs time to recover and time to heal from her addiction. This would also be a good time for her to think of some prevention strategies as well, so she does not slip into addiction again and relapse. And then case management and family counseling would also be very beneficial, since the family has experienced traumas and Kayla has experienced a sense of abandonment the last time she went into treatment, so she might be scared when it happens again. And then case management would be beneficial for her to get the resources she needs so she can stay clean from drugs. Thank you. Here are my resources and references.